Good afternoon, Miss Metz. I'm so glad you're going to get to go home today. So during your stay here, you were newly diagnosed with type 2 diabetes. So this is a very common condition in the United States, unfortunately, but it is really one of the more difficult diseases to manage and treat in your life. So the way it works is through the pancreas. So the pancreas releases something called insulin when it sees that you've ingested some kind of food. And so the insulin takes up the food and stores it in the form of energy, and that energy is called glucose. So it transports it into the cells for them to function properly. So for multiple reasons, your body has become resistant to the insulin that you produce, and so you can't really use the glucose that you have inside of your body when you eat something. So we need to get yourselves to accept this insulin again, because if it continues, you're at high risk of other really bad things. So this condition increases the amount of glucose in the body, which can over time increase the chances of you going blind, getting kidney disease, and several other bad conditions that are bad for your health. So with medications, we can lessen the chance of you getting these things. So I know you're probably curious as to why you got this condition. Unfortunately, we don't know the exact reason, but since you have a family history with your grandfather and your brother having it, this puts you at higher risk of having the condition. And also, people who are physically inactive and are obese are two of the other things that put you at higher risk of having it. So we can help up with easy ways to lose weight and becoming more active if you're interested. Just let us know, and we can come up with a time and another appointment or something like that. And most of them are free, so just tell us when you're ready. So today you've been prescribed canagliflozin, which should help with your condition by decreasing the amount of glucose in your blood. So this medication is called a sodium glucose cotransporter 2 inhibitor. So I know that's a big word, but so basically the way it works is in the kidneys. So where the glucose goes to be filtered out of the blood, and usually the glucose comes back into your blood by the kidneys. But with this medication, the glucose is prevented from coming back in, so it's taken out in the form of urine. So this will lower the amount of glucose in your blood, decrease all those bad side effects that I said earlier. This type of medication has a few side effects that we do want you to watch out for while you're taking it, especially like the first few weeks, first few months, that kind of thing. So just to clarify, you don't have any kidney disease or any kidney problems, correct? Okay, good. That's great. We just wanted to double check because this type of medicine, as I said before, works right in the kidneys, so we don't want to interfere with any problems that they have. So the main thing we want you to watch out for is urinary tract infections. Bacteria likes glucose because it's a form of energy, so it can follow the glucose out of the body and lead to it kind of colonizing in the urinary system, urinary tract. So just pay attention for any pain or blood when you urinate, that kind of thing. And then another two things that this medication can cause is dizziness and fatigue. So if you feel any kind of frequent dizziness or like having problems with fatigue and not being able to get out of bed or something, call us and we can kind of change the medication, change the dosage, something like that. We will have you coming back in a couple weeks to make sure your glucose levels are getting lower and the medication is working. And if you want, you can take your blood sugar home every morning, as I kind of taught you before, and keep track of what it is and bring that in. That would be a great thing. Also, make sure you work on your diet and trying to exercise. Being overweight and physically inactive are kind of really bad for you when combined with diabetes. I know it's hard, especially with some people's jobs, but we want you to stay healthy. I know there's a lot of information at one time, but can you tell me what you're going to do when you get home? All right, sounds good. You have a great day now.